Hello, nurses. Welcome back to Nurses Vlog. Actually, last couple of days I was busy with my patients, so I couldn't post anything. I'm really sorry for that. But today I'm here with most important cardiac terminologies, which will be useful for all the cardiac nurses as well as for the students who need to familiar with cardiovascular system. Okay, let's see the terminologies one by one now. Afterload, the amount of resistance to ejection of blood from the ventricle is called afterload. Apical impulse, impulse normally palpated at the fifth intercostal space, that is, left midclavicular line, which is caused by contraction of the left ventricle. Baroreceptors, nerve fibers located in the aortic arch and carotid arteries that are responsible for reflex control of the blood pressure. Cardiac catheterization, an invasive procedure used to measure cardiac chamber pressure and assess patency of the coronary arteries, is called cardiac catheterization. Cardiac conduction system, specialized heart cells strategically located throughout the heart that are responsible for methodically generating and coordinating the transmission of electrical impulses to the myocardial cells. This process is called cardiac conduction system. Cardiac output, the amount of blood pumped by each ventricle in liters per minute. Normal cardiac output is 5 liters per minute in the resting adult heart. Cardiac stress test. It is a test used to evaluate the functioning of the heart during a period of increased oxygen demand. Contractility, ability of the cardiac muscle to shorten in response to an electrical impulse, is called contractility. Depolarization, electrical activation of a cell caused by the influx of sodium into the cell while potassium exits the cell. Diastole, period of ventricular relaxation resulting in ventricular filling, is called diastole. Ejection fraction, percentage of the end diastolic blood volume ejected from the ventricle with each heartbeat, is called ejection fraction. Hemodynamic monitoring, use of monitoring devices to measure cardiovascular function, is called hemodynamic monitoring. Hypertension, blood pressure greater than 140 by 90 mm of mercury, is called hypertension. Hypotension, a decrease in blood pressure to less than 100 by 60 mm of mercury, is called hypotension. International normalized ratio, a standard method for reporting prothrombin levels, eliminating the variation in test results from laboratory to laboratory, that is INR or International Normalized Ratio. Cardiac murmurs, sounds created by abnormal turbulent flow of blood in the heart, is called cardiac murmurs. Myocardial ischemia, it's a condition in which heart muscle cells receive less oxygen than needed. Myocardium, it's a muscle layer of the heart responsible for the pumping action of the heart. Postural hypertension or orthostatic hypertension, it's a significant drop in blood pressure after an upright posture is assumed. Usually 10 mm of mercury systolic or more. Preload, degree of stretch of the cardiac muscle fibers at the end of the diastole, is called preload. Pulmonary vascular resistance, it's a resistance to right ventricle ejection of blood. Repolarization, it's a return of the cell to resting state caused by re-entry of potassium into the cell while sodium exits the cell. Sinoatrial node or SA node. It's a primary pacemaker of the heart, located in the right atrium, and which plays an important role in cardiac conduction system. Stroke volume. Amount of blood ejected from the ventricle per heartbeat. Normal stroke volume is 70 ml in the resting heart. Systemic vascular resistance. It's a resistance of left ventricle ejection. Systole. It's a period of ventricular contraction resulting in ejection of blood from the ventricles into the pulmonary artery and aorta. Telemetry. It is the process of continuous electrocardiographic monitoring by the transmission of radio waves from a battery operated transmitter worn by the patient. Venodilating agent. It's a medication causing dilation of veins. This is the end of today's video, Cardiac Terminologies Part 1, and I'll be back soon with Cardiac Terminologies Part 2. Please wait for that, and do not forget to subscribe our channel, like, share and comment your opinion below. Thank you for watching.